have 4.2% of the world's population. Our country represents 75% of the revenues for pharmaceutical companies. We spend in our country $1,126 per capita on drugs. In Britain, they spend about $240. They spend 1/5 of what we do. And Dr. Oz.
Thank you, Secretary Kennedy. This is the most powerful executive order on pharmacy pricing and health care ever in the history of our nation. And it's only happening because we have a president with the fortitude, the guts to stand up to the withering criticism and lobbying that's going to occur as soon as folks hear about the executive order. So on behalf of the child in Philadelphia who's got an autoimmune disease with a $1,000 a month drug, or the older woman in Los Angeles who's on a blood thinner who can't afford her copay, I want to thank President Trump. God bless you for having the guts to take on this industry. Thank you, sir. And if you look at these numbers, they actually reflect how much on top of the most favored nation price was being paid by the United States. So the closest to me, Bob, you can point to the Jardinians, the closest one, 289%, the one that's closest to you. That means that we are paying in America 4 times more than that drug costs in other countries. Again, 100% is the baseline. It's 289% above that baseline. It goes all the way down to where we're paying 50% more than any other country. That's the range. As was pointed out by President Trump, half the time we're paying 3 times more than is paid in other countries.
And what President Trump has done is a historic measure that should have been done a long time ago. What we're going to do is make sure that those prices become much closer to equal, like a competitive market you'd expect.
I've been a surgical oncologist at Johns Hopkins for 22 years, and I have seen patients suffer. We didn't take an oath to heal patients and then watch their life get ruined financially with their home, mortgage, retirement, going down the drain with GoFundMe campaigns, raising money from church communities and synagogues and friends they haven't seen in 20 years to try to raise money for what? For a system where Americans have been getting ripped off by 10, 12, 15 times higher prices than we see in other countries. The fundamental problem in healthcare is that we've had non-competitive markets. And we can do little things around the edges, or we can transform those markets to competitive markets, and that's what this executive order does today.